Hi, David Cuff, Executive Editor of HME Business Magazine, here live at day 2 of MedTrade East, and I'm here with Matt Mellott, CEO of Brightree. Matt, how you doing?
Good. It's great to be with you today.
Good show for you?
It is, yes.
It's good to be back.
It is. 2 years now? It's very good to be back.
Exactly. So a thing might have happened that people in the audience have heard about. It was called COVID-19. But in that happening, it created some interesting challenges in the way that HME providers interact with their patients and vice versa. And I think that it's kind of changed up the way providers have to think about connected care.
Yep.
What are these challenges? Paint a picture for me.
Sure. The focus of Brightree's Connected Care strategy is really to digitally connect our customers to their stakeholders.
Okay.
So we're talking the patient, we're talking referral sources, payers, vendors, partners. So it's a focus there. We've been working on that for years. It's kind of the core of what we do. But what's different now is that focus on the patient. And you're right, COVID really, I'd say even before COVID, right, we have Amazon out there. We have patients who basically want to be treated more like a consumer.
Yep.
Bring COVID along, and you just see an acceleration of that.
Okay.
So they want to interact with their providers. I mean, they're doing telehealth, they're booking appointments with their doctors, they're renewing their prescriptions with CVS, all without interacting with anybody. And I think that's what now is coming at the HME industry, and that's what we're focusing on.
And if anything, it was probably something that was going to happen anyway. I mean, this is the way a lot of people interact with all sorts of businesses in their lives, let alone healthcare providers.
100% agree. I think we just literally, COVID was the accelerant for that, but it was coming anyway.
Okay.
And as we all know, it's in so many other parts of healthcare. It's time for HME.
So it sounds to me like this isn't necessarily a challenge, but it's more of an opportunity.
Absolutely.
Okay.
Right. If this is done correctly, you hear about the threats from Amazon and other people coming into the HME industry. Those folks have figured out this, patient experience, giving them transparency, making it quick and easy, learning quickly about the product and services, potentially without interacting with anybody. So I think it is a huge opportunity that if we can help our customers and give them the tool sets to compete in that, really just sort of builds patient loyalty and eventually loyalty with the referral sources.
I think you touched on this before, but I'd like to flesh it out a little bit more. And that's where do providers kind of currently stand in this transition, or whatever we want to call it, where they're going to start providing more connected customer care? What's it like right now?
I'd say we're seeing the full spectrum right now. For those, let's say, who are the larger organizations, they're probably seeing a lot of this maybe around their resupply operations.
Okay.
So in that aspect, you're seeing some who are experimenting, let's say, with texting, saying, hey, we've got your referral source. Maybe some experimenting with online scheduling, for example. But it is spotty and using a variety of different systems. The beauty about with Brightree, when we take that on, we'll bring an integrated solution that is purpose-built for the HME industry. So we think huge opportunity, but what we like seeing that experimentation in the customer base is that they're all saying we need to do this, and we're looking for solutions that will do it well.
Gotcha. So we've got lots of different sort of scenarios in terms of where providers are in this journey. How do you help get them from here to there? How do you guys help them along that path?
Sure. Well, one is sort of like bringing the right assets into the mix, if you will. Our parent company, ResMed, purchased a company called Citus that is well known in the home infusion space for this patient experience and collaboration among collaboration tools.
Yeah.
So we've got that we can tap into. Bring that also on the work we've already done with Patient Hub in the past. And we really have a lot of the tools we can bring together and then take our customers on that journey. And a lot of it is fun right now because it's helping our customers even to think bigger than what they may be thinking they need a patient engagement app. This is so much bigger what we're talking about. It's engaging maybe with text with the patient early on. It's basically just making it efficient, transparent, and maybe an app comes into play down the road. But like I said, it's expanding their view of the patient experience. And we're excited to take them on that journey, and then you're going to hear more in the next interview about what we're building to meet that need.
Gotcha. Okay. And then when we get to the end, what's the grand vision? What's the if you kind of had to looking at providers in this connected care scenario, but also kind of zooming out in terms of how they fit in the world of post-acute. What does this look like?
Sure. I would say at the end of the day, you have a patient who probably has now built more loyalty to their HME provider. They like how they interact with them. They like how they get access to data, pay their bills, get reminders. So just integrating all of that, I'd say just puts them in a good place. And then in the future is our data available for if they're having a home health experience or in other areas of post-acute. But we could just do a lot to make, really help our customers make the HME experience smoother, more transparent, quicker, and just, we hope an overall better patient experience.
That word transparent, I think, is an interesting one.
Right.
Yeah, that's okay. Well, Matt, thank you very much for your time.
Absolutely, appreciate it. Thank you.
All right.